Hi, my name is Ginnie and my rehab protocol will be over the anterior cruciate ligament. There will be 5 phases to this protocol. The first phase is protection of the knee. The timeline for this is 0 to 2 weeks. The goals are to reduce swelling, extend the knee fully, have a flexion of 90 degrees, quad activation, and tolerate weight-bearing activities. The specific restrictions is that the patient needs to be on crutches within the first month to be able to avoid any weight on the knee. The patient will need to avoid any fast-moving twists and turns in order to not further injure the knee.
Phase 1 will cover 3 exercises. The muscles that will be targeted within these 3 exercises are the quads, hamstrings, and calves. For the first exercise, the patient will perform heel raises. They will do 3 sets of 10 reps. The second exercise for phase 1 are hill slides. Hill slides help with the range of motion, so the patient will be lying down with the uninjured leg bent and the other one straight. And the physical therapist can assist in having the patient bend the knee in a degree that is most comfortable. The patient will perform 3 sets of 10 reps. The third exercise for phase 1 will be short arc quads. The patient will use a small bolster underneath the knee, and they will lift their leg up straight with the toes pointed toward the knee. They will perform 3 sets of 10 reps.
The criteria for phase progression. In order for the patient to be able to move on to the next phase, they will need to be able to flex the knee at a 90-degree angle and work on full extension of the knee, along with a good amount of range of motion. On phase 2, we will focus on controlled stabilization. The time period for this will be 2 to 4 weeks. The goals are to focus on the gait of the patient in order to normalize it. Try to achieve full extension of the knee, work on flexion greater than 90 degrees, and work on isometric exercises for the knee.
The first exercise for phase 2 will be single leg stance. The patient is working on regaining balance. For this, it would be useful to have a chair nearby just in case they need some stability, but the patient should not rely on the chair either. They will perform 3 sets of 10 reps. The second exercise for phase 2, the patient will perform range of motion on a stationary bike going at a pretty normal, slow pace. The third exercise for phase 2 is terminal knee extension. The patient will need to have proper form in order to extend their knee. The patient will perform this 5 to 10 reps in 2 sets.
In order to be able to move on to the next phase, the patient will need to be able to have a normal gait and a flexion that is greater than 90 degrees. Phase 3 will focus on functional strength. The timeline for this is 4 to 12 weeks. The goals are the normal gait pattern along with proper speed, full range of motion, and comfortable stair climbing. The specific restrictions will be to not move too fast while walking, as we will want to avoid any further injury.
The first exercise for phase 3 will be the Stairmaster. If there is not a Stairmaster available, the patient can use the stairs. This will be beneficial for the patient, and it will help strengthen and burn fat while building lean muscle mass. They can do this 5 minutes 2 times through. The second exercise that is performed in phase 3 are quarter lunges. These are small lunges that the patient performs going a quarter of the way down. The stance is slightly more narrow with chest up and straight back. They will perform 3 sets of 15 reps on both sides. The third exercise performed in phase 3 are ladder drills. This is a good way for the patient to improve on foot speed, agility, and coordination. They will perform this 2 times through for the single leg forward hop and 4 times through for the 2-foot run. The first one that's performed is the single leg forward hop. The second exercise that is performed is the 2-foot run.
The Before the patient can move on to the next phase, they need to be able to perform with a normal gait function and speed, along with full range of motion of the knee without any pain. Phase 4 will focus on performance. The timeline for this is 12 to 24 weeks. The goals are to have a full pain-free range of motion, no joint irritation, progress in strength, power, and flexibility. The specific restrictions is adding enough weight to the knee, but not to the point where the muscle tissue is overstressed.
The first exercise for phase 4 is a walk-jog progression. The patient will walk on the treadmill at a steady pace, increasing speed later in the set until the patient is at a steady jog. They will perform a 3-minute walk at a normal pace of 80% and a jog for 1 minute. This will be performed 3 to 4 times through. The second exercise for phase 4, we will continue to progress on flexibility and strengthening. We will use the leg press machine for the patient in order to strengthen the knee. They will perform 2 minutes for each leg and then 2 minutes for both legs. Make sure that the patient does not lock their knee while they are in full extension. The third exercise for phase 4, we will work on biking at 80 to 85%. 3 minutes forward and then 3 minutes backwards, 1 to 2 times through.
In order to make sure that the patient is ready for the next phase, we will need to make sure that they are pain-free throughout all aspects of range of motion with proper strength and power and no joint irritation. Phase 5 is the return to sport. The timeline for this is 24 to 36 weeks. The goals are for the patient to have a safe return to athletics and maintain strength, endurance, and proprioception. The specific restrictions for the patient is to make sure that they are able to perform at full function without any pain.
There will be 3 exercises for phase 5. The muscles targeted will be plantar flexors, dorsiflexors, calves, quads, and hamstrings. The first exercise is figure 8 jogging. The patient will run in a figure 8 around 2 cones, placed about 10 yards apart. They will do this 4 times through for 3 to 5 sets. The second exercise that will be performed in phase 5 are ladder drills. The patient will perform a 1-foot jump in and 2 feet jump out. The second exercise, the patient will perform switching feet. This will improve agility and strengthen the tendons around the knees. This also will help with balance. For each exercise, there will be 4 rounds at 85 to 90%. Depending on what sport the patient is involved in, we will make it more sport-specific drills in a controlled environment. For this example, we will be using swimming. Before the swimmer gets in the water, they should perform kicking on land. Example 1 is flutter kick. Example 2 is breaststroke kick. In order for the patient to be able to fully complete the rehabilitation program, they will need to prove to the physical therapist that they are equipped with knowledge to continue and improve strength while knowing how to protect their knees. Thank you for watching this video.
Thanks, Ginnie, for fixing my knee.